Maxicare will make it available for those Maxicare members who registered for these events. The wellness team will be sending out a link to you. Now, do remember that these videos are the intellectual property of Maxicare or its affiliated partners. As such, unauthorized copying, reproduction, republishing, uploading, posting, transmitting, or duplicating of the whole or even part of this video is strictly prohibited. Furthermore, this video is made available to Maxicare members only and offered strictly for educational and informational purposes. Welcome once again to Maxi Life Wellness Fridays featuring the heart in time of COVID-19. Again, I'm Patricia Bermudez. He's on your host for this event. Today, we will be joined by one of the country's best doctors in cardiology. Tamang-tama dahil month of hearts ngayon. We need to check up on our heart, especially because we are still in this pandemic, and those with heart problems are at a higher risk of contracting the virus. I'm personally very excited and, of course, very curious as to what I can learn further from this event. Now, this session will be very helpful for all of us so we can prevent or reduce the risk of heart diseases and complications. With the knowledge that we will gain today, we can be more mindful of our health, of our heart health in particular, and be able to seek our doctor's advice as early as possible. Now, it's time to meet your speaker. Our speaker has a subspecialty of interventional cardiology. He is an assistant professor in the College of Medicine at the University of the East Ramon Magsaysay Memorial Medical Center, one of the directors of the Philippine Heart Association Board, and the training officer in the Adult Cardiology Fellowship in the Heart Institute of St. Luke's Global City. Ladies and gentlemen, let us welcome Dr. Rodney Jimenez. Hi, Doc Rod Jimenez.
Hello.
Great to see you,
Hi.
Doc.
Hi, good afternoon, Patricia. Nice to see you too.
All right, well, I'll
Lunch
turn it over
time.
to you. Yes, because everyone's hearts is full and they're so ready for what you're going to be sharing with us, myself too. So, Doc Rod Jimenez, go ahead, take it away. Thanks so
Okay,
much.
thank you. Wait. Okay.
And as Doc is getting ready, again, I advise everyone to please change their names to include also their company names. And we welcome you once again to our Maxi Life Wellness Fridays featuring the heart in the time of COVID-19. Again, here is our speaker, Dr. Rodney Jimenez.
Thank you, Patricia. Okay. Again, I'm Dr. Rodney Jimenez. Welcome to this Maxicare event. I'm so honored to be one of you, to be a speaker in this event of Maxicare. And I'm going to talk about, as what Patricia has told you a while ago, I'm going to talk about a heart in the time of COVID-19. Okay. I have nothing to disclose. Okay. And my objectives for today is just to describe the heart disease, particularly atherosclerosis. I'll describe to you what atherosclerosis is. So you should be able to memorize or remember this term, atherosclerosis, no? That
Actually,
causes heart
Doc,
attack.
I'm really looking forward to your talk and already with the objectives that you have shared with us. It's very interesting and very relevant. But Doc, may I ask you to put your presentation on presentation mode,
Yeah.
not
Okay.
on presenters mode? And as Doc is adjusting his presentation, may I also just remind everyone that after his session, we will have a Q&A with Dr. Rod Castro, after which we will also have a raffle. So please do stick around for that. And I've been saying this over and over again, it'll be great for the heart. So again, I turn it back over to you, Dr. Jimenez.
Is that okay already?
It's perfect. Thank you.
Okay. Thank you. Okay. So, oh, sorry. So, and then I'm going to enumerate ways of preventing heart attack. I think this is the most important uh, part of my talk today, no? And then to briefly describe the effect of COVID-19 to the heart, because some of us napapabayaan yung heart disease and yung heart natin, and then eventually nahawa tayo and alam natin that those people with heart disease mas prone to having severe COVID, no? Okay, so dapat makontrol natin. Okay. So there are ways of keeping your heart healthy within lives, which is the Life Simple 7. Okay? Madali lang to. So first is keeping your heart healthy. Most important ways to make sure you are feeling your very best. Okay, if you have to start doing small things every day that will keep your body healthy, you have a better chance of living a longer, happier, and healthier life. Okay, and then having a good heart health will also make you less likely to develop many other types of diseases like cancer and type 2 diabetes. Okay, these are the Life Simple 7. So avoid smoking and using tobacco products, not only the cigarettes, but also other tobacco products. No? Hindi porket hindi siya umuusok, okay, hindi na siya mabuti na siya, no? And be physically active every day. Eat a heart healthy diet. Keep a healthy weight and keep your blood pressure healthy, keep your total cholesterol healthy, and keep your blood sugar healthy also. Okay. This Simple 7 or Life Simple 7, I will be tackling this and mentioning this very often in my talk today. Okay. So what is heart disease? Or in scientific term, this is the cardiovascular disease or CVD. This is a very serious health condition and keeps the heart or blood vessels from working properly. Okay? And when our heart and blood vessels working at their best, blood flows easily and is circulated around the body freely. Kung walang bara, edi mas maganda ang blood flow to our organs, no? Especially our brain, our heart, and kidneys, and also our eyes. So, this is what I have told you a while ago, the term atherosclerosis. No? Okay, atherosclerosis is a clog in our blood vessels. It prevents blood from being delivered to many important parts of our body, as I've mentioned a while ago, and can cause serious illness or death. So ito yung um, uh, clot, no? Yung cholesterol, and then preventing the blood from flowing to our organs or important organs. And this is the leading cause of mortality or morbidity. So ito yung leading cause ng death sa buong mundo and sa buong Pilipinas. Okay? Hindi lang sa US, hindi lang sa developed nations. Okay? This is the hardening of the arteries. So Greek root, no? Gruel. So hardness. Okay? And then some are born with it. Yung mga may familial hypercholesterolemia, and some are not, and most develop through time, no? Kasi kakakain natin ng hindi magandang pagkain, okay? Or poor lifestyle habits.
When you have
So I have
atherosclerosis, a fatty material called plaque builds up inside the walls of your arteries. It's a problem because it can reduce or completely block blood flow and lead to a heart attack or a stroke. No one knows exactly why it happens, but scientists think it begins with damage to the inner wall of an artery. It can start as early as childhood. It starts when things traveling in the blood, like cholesterol, fats, calcium, and waste products, collect in the damaged part of the artery wall. With all of it bunched together, chemical reactions start to happen with your body's bad LDL cholesterol. This triggers inflammation, and cells at the site release chemicals that call for help. Your immune system sends white blood cells to the damaged site. They begin to eat the cholesterol. This sounds good, but it isn't. The cells change into foam, and those foam cells form plaque. As the plaque increases, the artery wall thickens and hardens. At the same time, muscle cells in the artery wall start multiplying, and they move to the surface of the plaque. They contribute to the problem by forming a hard cover or cap over the plaque. Eventually, the artery narrows enough to reduce blood flow, which reduces the amount of oxygen nearby organs can receive. Over time, the cap may break open and release all this plaque into the bloodstream. It can flow downstream in the artery and form a blood clot, which can stop blood flow altogether. When that happens, blood supply becomes limited to the areas around the clot. If it happens in your heart, it causes a heart attack. If it happens in your brain, it causes a stroke.
So you see, it's not only in the heart, it can also cause problems in your um, other organs like the brain. So what is stroke? No, iba naman ng heart attack sa stroke. So as mentioned by the video a while ago, it can happen to your heart. It can also happen to your brain. No? So ganun din yung physiology o yung mechanism ng pangyayari ng heart attack. Ang tawag naman sa brain ay stroke. So a stroke when a blood vessel that carries oxygen to the brain is blocked or burst. No? So sumasabog siya. And these are some of the signs of the stroke. So act fast. Just remember the act fast. Fast is for something is going on with your face. No? May nangingiwi. No? So hindi pareho yung ngipin nyo. No? Yung isa mas nakangiti, yung isa mas sad, yung itsura. And then yung A, yung arms mo, weaker yung isa. O kaya yung legs, no? Weaker yung isa. Okay? And then slurring of speech, no? There's a difficulty in speaking. O kaya parang lasing kung magsalita bigla, no? And then act fast if someone is experiencing this because we can save them, no? Within 3 hours dapat ma-save natin sila. Maidala natin sila sa emergency room, no? Okay. And these are some of the risk factors for heart disease. Ano ba yung risk factors na yon? Okay. There are non-modifiable. Ibig sabihin, wala na tayong magagawa doon. No? Andun na yun eh. So, isa doon is male sex. No? Pag lalaki ka, mas prone ka to have a heart disease or stroke, no? Compared to babae. Okay? Advanced age, wala na tayong magagawa din doon. Wala namang bumabata pa sa ngayon, no? Instead of pabata, patanda talaga tayo. And then genetic. Sorry, wala na tayong magagawa. Yun ang pinamana ng ating mga magulang instead of kayamanan. No? So, huwag naman natin silang sisihin. No? Pero these are non-modifiable risk factors. Pero meron din tayong modifiable risk factors. Pwede nating iwasan, no? Or pwede nating i-control. Like yung dyslipidemia or mataas yung cholesterol, yung mataas yung LDL or yung bad cholesterol, or decrease yung good cholesterol or HDL. And pwede natin maiwasan ng tobacco smoking. Pwede rin natin makontrol yung blood pressure. And pwede natin makontrol yung diabetes mellitus or metabolic syndrome or yung kasama sa mataas sa blood sugar ay yung medyo mataba ka, no? Sedentary lifestyle, yung lack of physical activity, and then yung estrogen status, no? Yung mga perimenopausal or menopause people, pwede rin natin magawa ng paraan yan, no? I'd like to mention also that if you're already in menopause already, you are equal risk with the male, no? So pagka menopause ka na, kasabayan mo na ngayon yung mga lalaki. No? Kung hindi maaga mamamatay yung mga lalaki. No? Pagka naagapan nila yung, iwasan nila yung age of 45 na nagka-heart attack sila, and then umabot sila ng 50, and then kayo menopause na, pareho na equal na yung risk ninyo ng pagkaroon ng heart attack or heart disease or stroke. Okay. And this is the clinical sequelae of atherosclerosis. So, hindi lang sa heart, pati sa brain, yung tinatawag natin stroke, and pwede rin siya magbara sa kidneys na pwede kayong ma-dialysis balang araw, or lumaki yung mga ugat natin sa gitna, no? Yung tinatawag nating aneurysm, no? And then the peripheral artery disease, or yung mga ugat natin sa ating mga legs and hands na pwedeng maputol yung ating mga paa. Okay? And then these are the clinical features of heart attack or problems with uh, coronary arteries or yung mga ugat natin sa ating puso. So ito yung tinatawag nating angina. Angina means chest discomfort. No, chest discomfort can be uh, experienced as having pressure or mabigat, no? Parang may nakadagan na hollow blocks, no, sa inyong puso, no? Kung hindi man kayo nadaganan ng mga hollow blocks o may taong dumagan sa inyo, no, sa chest ninyo, kung yun yung na-experience na ninyo, or choking sensation, parang sinasakal, or mainit, no, or squeezing, parang mayroong pumipiga sa loob ng inyong uh, dibdib. And then pain localized primarily in the epigastrium o parang nasa tiyan, no? Sa tiyan dito sa inyong sikmura, parang masakit. And then it radiates to your shoulders. Pwede rin sa left, pwede rin sa right, or neck, or sa inyong jaw. And then pain precipitated by exertion. Kung hindi to heart attack or stable lang yung problem with your heart, no, nagkaroon ng bara pero stable pa kayo, pagka ito ay effort related o ibig sabihin sumasakit ang inyong dibdib pagka kayo naglalakad, umakyat ng hagdanan, naglalaba, lahat ng mga ginagawa, nag-exercise, most likely this is coming from the heart. Okay? Pag hindi yan, pagka nangyayari yan during rest, tapos hindi siya nangyayari during exercise, most likely hindi yan heart. No? So dapat na precipitate siya or lalong lumalala yung inyong chest discomfort during exertion and nawawala during rest. No? Unless meron kayong heart attack. Yun naman pag heart attack, tuloy-tuloy yung chest pain. No? Increase yung severity and or frequency. Or nahihirapan kayo huminga. Okay. Next. Ano yung mga diagnostic tests na pwede natin gawin para malaman natin kung meron kayong problem sa heart? ECG, stress test, tulad nitong nasa picture na to. You can do a treadmill exercise test. This one simulates effort. No? So, pinapa-exercise kayo to increase the heart rate or to increase the stress in your heart. No? So as to simulate and stimulate also the pain or chest pain during the exertion. Okay. And then to check if there are also other comorbidities or associated morbid illness. That's why we need to get fasting blood sugar, lipid profile, creatinine, liver profile, and chest x-ray, aside from the stress test and ECG. So as to look for the cousins or pinsan ng heart problems. No? Okay, so let's get started with Life's Simple 7. So you make many choices every day, like ano yung susuot nating color for the day or how to fix your hair. Sorry na lang sa akin, I have no hair to fix, but lucky for me also, I think. So when it comes to making decisions also, it may seem too difficult to choose, just like choosing the color of your socks. No? Ganun din sa pag-choose ng paano maging healthy ang ating lifestyle. So take small steps. Okay? First is, again, don't smoke or use smokeless tobacco. No? Wala sa mga studies. None of the studies have shown that smoking is good to our health. Okay? Wala. Everything, all of the studies that came out revealed that there's a cigarette smoking or tobacco causes problems, especially heart problems, stroke, cancer, and prostate problems. Okay? Tobacco kasi contains a nicotine. It's very addictive. So once na start nyo na yan, mahirap nang umalis. Okay? Vapes also have nicotines. No? So lalo lang kayo nagiging addict din doon sa vape na may nicotine din dyan. So just because these products are high-tech, it doesn't mean they are safe. Okay? Just because they don't produce smoke doesn't mean they are safe also. It damages every organ in your body. Okay? So using smokeless tobacco is not a safe alternative to smoking. Okay. These are the harmful chemicals that can be found uh, in the cigarette, no? Okay, or smokeless tobacco. So thousands, pero ito yung mga pinaka-importante. Okay, so merong acetone that can be seen in nail polish removers, hydrogen cyanides, insecticide, methanol, antifreeze, cadmium seen in batteries, okay, toluene in paint thinner, and in a lot more. Meron ding lead also, once previously used in paint. Okay, so a lot, thousands. And then secondhand smoke is dangerous too. Remember, if you can smell the smoke, then the chemicals are getting into your body. So avoid smokers. Okay. Okay. Peer pressure and smoking. Okay. So if someone wants to try to smoke, ito yung pwedeng sabihin on how to say no. No? Be direct. I don't want to smoke. Okay. Okay. Change the subject. Okay. If a friend asks you if you want to smoke, baka pwede maglaro na lang tayo ng basketball or to watch a movie or to take a walk, no, instead of uh, smoking. Have a good joke or comeback line ready, no? Say something like, no thanks, I'm a big fan of breathing, ng paghinga ng maganda. Okay? And then, pwede also that walk away. If you feel very uncomfortable, then just walk away. It's easy as that. Okay? And blame it on something else or someone else. No, my wife wants me to go home, so I gotta go. So just walk away. Okay, and then avoid the situation. Okay, if you see friends sneaking around with tobacco, pwede na kayo umiwas. No, uh, uh, pwede nyo iwasan yung mga barkada nyo na nagsisigarilyo. Okay? Kung nakikita nyo sila ng sigarilyo, wag na muna kayong lumapit sa kanya. Kausapin nyo na lang sila sa ibang sitwasyon. Okay? Okay. So pick your favorite way to say no and try it out. Okay? So get comfortable in saying in front of a mirror. Okay. So it may seem awkward at first, pero kailangan sanayan natin. Okay? Number 2 in Life Simple 7, be physically active. No? So regular physical activity makes your heart very healthy, your bones, your muscles, and your well-being. Okay, it can improve self-esteem, your mood, okay, and increases your energy. And the American Heart Association, also the Philippine Heart Association, recommends at least 60 minutes of moderate to vigorous physical activity every day. Or recently, sinabi lang, just move, no? Maggumalaw lang tayo. And in the Philippine Heart Association, we have this advocacy, yung Sneakers Friday. Better to wear sneakers as much as possible, so it will make you comfortable to walk, and we encourage 10,000 steps a day. Okay, so madali siya gawin. Okay, so kaya siya Sneakers Friday kasi supposedly we're going to promote this in offices, no? Kasi pag Friday lang allowed yung mga office workers to wear casual clothings like sneakers or rubber shoes. Okay, so magsuot ng sapatos ng goma tuwing Biyernes. Pero ngayon, I think they are allowing already everyone or everybody to wear sneakers. Pwede nang magsuot ng rubber shoes sa offices. Depende sa office pero marami na ngayon. No? Or if you want to buy ng sapatos, yung rubber, yung soles para mas madaling maglakad. No? So, and we also have this Fit Heart Minute na tinatawag namin that you have to walk or you have to move every hour, no? For 1 minute. Okay? So pag i-alarm niyo yung watch ninyo na every hour, tatayo kayo and mag-walk kayo for at least a minute. Okay? So Fit Heart Minute ng Philippine Heart Association. And these are the types of moderate and vigorous physical activity: biking, brisk walking, tennis, gardening, jogging, okay? Or football, hiking, dancing, okay? Yan yung mga pwede nyong gawin, okay? So what are your favorite ways to be physically active? Think of 3 things you can do next week to be physically active, or probably later on, no? And track your total activities. Better talaga, pinakamadali, for me, is 10,000 steps. Okay? So may phone naman kayo, or may Fitbit kayo, or may Apple Watch kayo that can monitor your steps. Okay? Okay, maraming ways. Eat a heart healthy. This is a diagram. For me, it's very easy na to show. Yung half of the plate should contain more vegetables or fruits. Okay? Except yung fruits na, except the high glycemic index. Mamaya I'll talk to you about the high glycemic index food na fruits. Okay? So, ito yung mga fruits. Pwede apple, okay, berries, and then vegetables, green leafy vegetables. Huwag yung medyo mataas sa starch, like huwag masyado yung potato na masyado mataas sa starch. And then whole grain food, no? Yung mga brown rice, red rice, or black rice, okay? Better yon. Or yung wheat bread. And then the protein, high in protein, yung nuts, or yung fish, or yung chicken breast, or eggs, okay, high in proteins, okay? And then we have to avoid yung mga bad fats, no? Yung mga nakikita natin sa pork chop, okay, yung red meat, and then, okay, okay. And limit also yung sugary beverages, no? So, mas maganda, water, no? Always take water. Ito, water. Siya ang pinakamaganda. Okay, what can you do to eat heart healthy? Okay. Eat plenty of fruits and vegetables. Better if 5 servings in a day. Try to eat a variety of fruits and vegetables each day. Okay. Choose, again, I've mentioned a while ago, choose whole grain food, no? Like whole wheat, bread, oatmeal, brown rice. Eat fish, especially oily fish like salmon, trout, herring, no? At least twice a week. And limit your intake of saturated and trans fats. Ano ba yung mga saturated and trans fat? Yung mga fried, uh, ano nga ba ito sa McDonald's? Yung mga fries. No? Pag yun. Okay. Did you know that a 12 ounce of soda or Coke, regular Coke, contains 8 teaspoons of sugar? Imagine yourself eating or taking a teaspoonful of sugar. No? Talagang magkaka-diabetes kayo later on. Choose low-fat dairy products such as skim milk or fat yogurt. Limit your intake of beverages and food with added sugar. So avoid Coke or avoid soda. If you cannot control, then take Coke Zero or zero calories na sugar or sugar zero na soda. If lang, no? Hindi nyo talaga matiis, pero better water. No? Learn about sodium. Remember, pwede lang tayong 2 grams of salt in a day para maiwasan natin hypertension. So yung 2 grams of salt, ibig sabihin yung isang kutsarita lang ng teaspoon in a day. No? Isang kutsarita lang ng salt. If you want to eat snacks, go nuts. No? Kain ka na lang kayo ng peanut, 2 tablespoons of nuts. Okay? Or whole nuts. Okay? Drink water instead of sugary beverage. So now it's your turn. Sulat ninyo. Write down what you eat or what you ate this week. Okay? And then check ninyo kung ilang calories yung natitake ninyo every day. Okay? And then i-check nyo rin kung ano na yung mga type of food that you are taking. And then probably with that, malalaman mo kung healthy ba talaga yung nakakain mo or unhealthy. Okay, give yourself a week. Yun lang talaga kung ano yung kinakain, tapos ilista ninyo. And then malalaman ninyo na unhealthy pala yung kinakain. Keep a healthy weight. No? So dapat alam natin by height, okay, alam natin kung ano dapat yung weight natin. Okay. So meron yan, you can Google it, no, para ma-compute natin yung BMI. Okay. So as your body grows, pag tumatanda tayo, lalo tayong nag-weaken yung metabolism natin. So mas lalo tayong tumataba pag tumatanda tayo. So we have to avoid gaining weight. Okay, lalo na pag tumatanda. Okay, so gaining too much weight is very dangerous to your health. So overweight or obesity, more body fat, then it's considered un, uh, unhealthy. So it increases your uh, risk for having diabetes, heart disease, hypertension, asthma, and breathing problems. Maraming pwedeng mag-cause. So you can, one way of dieting or controlling your weight is remember what you eat is also supposedly dapat yun din yung energy, and energy that you take in is what you eat, and then dapat ganun din yung energy that you consume, no? So halimbawa, running for 5 kilometers will only take mga 250 to 500 calories or 250 calories lang. Isang rice, na isang buong rice, na cup of rice na white rice, it's about 150 calories, no, to 200 calories, no, depende sa cup na minimeasure ninyo, no? So tatakbo ka ng ilang 30 minutes ng pagtakbo, isang rice lang yung nababawas ninyo, no? So dapat you should be aware of the calories that you are taking and the calories that you are taking out. Okay? Now it's your turn, no? So again, remember, ilog din nyo yung mga kinakain niyo. Remember those calories, or you can take a look in the internet or an app. Okay, how many calories have you eaten? Okay, in a day. Okay, so and then number 5, we're almost done. Kasi 5, keep your blood pressure healthy. What is the normal blood pressure ba? So blood pressure is a measure of how easy or difficult it is for the blood to pump by your heart through your body to give oxygen and nutrients to your vital organs. Okay? So your blood pressure normally rises depending on the stress or the effort that you exert. Okay? So pag tumatakbo, tataas talaga yung blood pressure. Kung stress kayo or in pain, tataas talaga yung blood pressure niyo. So the normal blood pressure is less than 120 over 80. Okay? So high blood pressure or hypertension is 140 or equal to 140 over 90. Pag gano'n na yung blood pressure nyo lagi, not necessarily, dapat pagka tinitake nyo yung blood pressure nyo, dapat 5 minutes into resting kayo and then let somebody take your blood pressure. Pagka rested na kayo, tapos mas mataas pa rin yung blood pressure nyo than 140 or over 90, and then most likely baka you're having hypertension. Take it twice in a day. Okay, para malaman nyo, okay naman ako, relax naman ako, pero mataas pa rin yung blood pressure mo. So remember, hypertension is an important risk factor for heart disease. Okay? To avoid increase in blood pressure, dapat keep your weight healthy. Eat less sodium o yung mga alat. So ano yung mga maraming mga alat? Yung mga snacks natin, no? Yung mga chips, mga kinakain natin pag kumakain tayo, pag nanonood tayo Netflix. And then get enough regular physical activity. So measuring blood pressure is quick and painless. Okay, you let your blood pressure be measured by your nurses or your doctors. Okay, always rest muna for 5 minutes before you ask somebody to take your blood pressure. Okay. Now, let's keep your total cholesterol under control. HDL is the good cholesterol and the LDL is the bad cholesterol. Remember na lang, LDL is the lechon de leche. So yun yung bad, no? cholesterol. Okay? So it's a waxy substance that goes into your bloodstream, no? And then dumidikit siya sa blood vessel. Yun yung mga pinakita ko sa inyong video kanina, no? So, okay, some cholesterol important for good health, like yung mga olive oil, okay, yan yung mga good cholesterol. And too much cholesterol is not good to our uh, blood vessels. Okay? So ito yung normal artery. Okay, pagka nag-build up yung cholesterol, it will narrow. No? Pagka ganyan sa heart, makaka-experience na tayo ng chest pain. And then pag nag-chip off yan, it will cause heart attack, yung plaque. No? Okay, so keep your total cholesterol under control. Remember, genetic din ang increase in cholesterol. No? So swerte yung mga taong hindi nag-increase in cholesterol kahit anong kainin nila. But 25% of the cholesterol is being taken through eating. Okay? So what we eat, 25 of cholesterol comes directly from what we eat. Okay, these are the good cholesterol, no? Yung mga salmon, okay, berries, avocados, olive oil, no? Dark chocolates, nuts, soy, okay, whole grains. Okay, yan yung magbibigay ng good cholesterol and will sweep away your bad cholesterol. Okay. So these are the number 7 naman, keeping your blood sugar in healthy levels. So to avoid high blood sugar in your bloodstream, okay, you avoid this high glycemic index. Itong mga to, no, mga ice cream, no, sweet yogurt, grapes, banana, matataas yung glycemic index yan. Watermelon, okay? Ito naman yung mga okay ang mga glycemic index o ibig sabihin mababa yung sugar sa loob ng fruits or ng food na yon, okay? Yung milk or soy milk, natural yogurt, oatmeal and beans, okay, berries, okay, dark chocolates, okay, hummus, tapos chickpeas, garlic, onion, eggplant, broccoli, cabbage, tomatoes, and mushrooms and lettuce. Okay. So diabetes naman, yan yung mataas yung blood sugar sa katawan natin, sa blood natin. No? So 126 milligrams per deciliter and above, that means diabetic na kayo. So if you are diabetic, it's a risk factor for having heart disease and stroke, heart attack, and kidney disease, and peripheral artery disease, or yung nagbabara yung mga ugat sa ating mga legs. No? Okay. Diabetes also, may type 1 diabetes. Ito yung mga sa bata, no? Or yung mga taong pinanganak na may problem in producing insulin in our body. In type 2 naman, ito yung acquired or genetic din, happens to be na yung body does not respond well to insulin, lalo na yung matataba. No? Pagka obese kayo, pag maraming taba, no, so nagkakaroon ng insulin resistance, hindi nagagamit yung insulin because of the fats that we have, no? Hindi nagagamit ng insulin ng muscle yung insulin. Okay? Yan yung type 2 diabetes. Okay? Some of the problems that can be developed, no, with diabetes, yun nga, mention ko na, heart disease, stroke, hypertension, eye damage, kidney damage, and foot damage, even amputation, and hearing problems. No? 2 to 3 times magkakaroon ng heart disease yung mga may diabetic patients, no? And 2 to 4 times higher no, heart disease morbidity and mortalities na mamamatay. Okay? And 60% chance of dying from heart disease pag may diabetes kayo. Okay? And these are the warning signs of may diabetes. No? Frequently thirsty, laging nauuhaw, laging pagod, frequently tired, laging gutom, frequently hungry, blurry vision, going to the bathroom frequently kasi nga yung sugar ninyo mataas sa blood ninyo, osmosis, ina-attract niya yung water, lalo kayo naiihi. No? So lagi kayong dehydrated also. And then because of that, nung mataas yung blood sugar niyo, parang naglo-lose kayo ng weight na hindi niyo naman pala sinasadya. No? Yan yung mga uncontrolled blood sugar. So if you have any warning signs of diabetes, dapat you should be checked by your doctors. No? Pag diabetes kayo, ito yung mga A1C test ng 6.5 and above, pag fasting blood sugar, 126 milligrams per deciliters, or yung glucose tolerance test na 200 milligrams per deciliter. No? Ito yung mga diabetes. Ito naman yung pre-diabetes. So dapat ito yung normal, below 5.7% or below 100, or pagka glucose tolerance test, below 140. Okay? Okay, now it's your turn. Okay, to improve your blood sugar, blood glucose in your body. Okay, dapat avoid smoking, use tobacco and using of tobacco products. Ito yung 4 of the 7, no, kanina, and be physically active. Eat heart healthy diet every day and keep a healthy weight. Okay, remember, you can stop heart disease before it starts. Start small and keep it simple. Make one change today or take it simple, baby steps, and then you are ready to make another step. So again, avoid smoking, be physically active, okay? Eat heart healthy diet, keep a healthy weight, okay? Keep your blood pressure healthy and keep your total cholesterol healthy and good blood sugar control, okay? Okay. So with regard to COVID-19, always remember, if you are diabetic or problems with hypertension or you have a heart disease, you are more prone to have a severe COVID, no? So hindi lang madaling mahawa, magkakaroon pa kayo ng mas malalang COVID-19. So dapat talaga you have to make iwas, no? sa COVID na dapat, kasi mas lalong nagkakaroon yan. And obesity also, okay? Pag nagkaroon na kayo ng COVID, ito yung mga pwede maging problems. No? Mas prone for them to have stroke, heart attack, or problems with the rhythm of the heart, clogging, nagbabara yung mga ugat ninyo, and stroke, and then namamaga yung heart or myocarditis ang tawag. Ngayon, COVID-19 also, dahil natatakot tayo lumabas din, no? So dapat din pakinggan niyo or tandaan niyo yung mga sinabi ko kanina. No? So kasi lagi natin napapabayaan. I think I heard, no, na mas dumami ngayon yung mga hypertensive patients, no, kasi napabayaan nila during COVID-19 na naka-lockdown sila or natatakot sila to go to the hospital. Okay, go to a very nice hospital na matingin yung controlled yung or maganda yung delineation ng COVID-19 patients sa mga non-COVID, no? Kasi pagka ito napapabayaan din natin, di parang ganun din, no? Hindi naiwasan din nga natin yung COVID, pero hindi natin naiwasan yung problems with our heart. Okay? That would be all. Thank you very much. I hope I can answer your questions later on. Okay. Thank you, Patricia.
Yes, thank you so much, Dr. Rodney. We all learned so much about the heart and what practical things that you shared with us. Those are really going to be helpful for us to really think about our lifestyles now and how we ought to change it for the better. And of course, what COVID-19 can do to it, and also the practices that we can do so we can take better care of it, especially during these times. You know, it's so important. Thanks so much for taking us through that. Ang dami kong questions, pero napansin ko, maski kakaumpisa pa lang ng presentation mo, Doc Rodney, ang dami na rin questions na pumasok. And I'm sure our Maxicare members are all eager to hear what the answers to these questions are. But for now, allow me to call on someone who will facilitate this Q&A. Today's moderator specializes in IM cardiology and cardiac intensive care. He is an active consultant of the University of the East Ramon Magsaysay Memorial Medical Center, St. Luke's Medical Center in Quezon City, and Global City. He is also an associate active consultant at the Makati Medical Center, assistant professor in UERM College of Medicine, and head of cardiovascular care unit and cardiovascular recovery room at St. Luke's Medical Center in Quezon City. I am looking forward to this discussion with Dr. Rod Castro. Good afternoon, Dr. Castro.
Hello, good afternoon.
Hi,
Hello,
Dr.
can you hear me?
Castro.
Yeah, thank you so much, Patricia, for that very kind introduction. And indeed, heart in the time of COVID-19, as discussed by Dr. Rodney Jimenez. Really very interesting and very educational. Thank you so much, Dr. Jimenez, for that very extensive and very practical discussion about taking care of your heart, especially this time of pandemic. Okay, so I guess I have a lot of questions here to discuss to ask to our speaker, Dr. Rodney. But as a brief introduction to our audience, again, welcome to Maxicare Lay Forum, no? And thank you again for inviting me as your moderator, Ma'am Patricia, and of course, Dr. Jimenez. As a review, no, globally, we have 109,594,835 confirmed cases of COVID-19. And in the Philippines, as of yesterday, we have 555,163 confirmed COVID positive, and we have 2.10% of death, or that's accounting for 11,673. So the reason why I'm citing this is because as Dr. Jimenez mentioned on his last slide about COVID-19 and your heart, okay, that's why Dr. Jimenez was very good in discussing how to take good care of your heart, especially having that knowledge in atherosclerosis, for us to really protect your heart. Okay, so Dr. Jimenez, thank you again, and I have here a lot of questions from our audience, and I guess we have a good audience here, good number of audience here in this session. So, are you ready, Dr. Jimenez? Ready ka na po?
Yes.
Okay.
Contest.
Parang contest. Actually, dito naman, our first question actually is about, well, hindi siya masyado na-discuss earlier, but it has a practical, they will be hearing a practical answer, because the question is, are there maintenance meds that are okay po for breastfeeding mothers? Especially those mothers who have issues po with their heart.
Okay. Usually we give the other calcium channel blockers na binibigyan natin yung nifedipine. So meron din yung other peripherally acting na mga medications na walang problem with lactation. So you have to consult your doctors. Kung ano yung depende rin sa present situation, kung meron kang ibang other comorbidities aside from just being pregnant or lactating. So you have to consult your doctor for that. Okay?
Okay. Thank you, Dr. Jimenez. Remember dapat magpakonsulta kayo. Huwag kayong magdoktor-doktoran kasi you're protecting the mother, and of course yung baby po niya. Okay, thank you. For our second question po, Doc, meron ding question na, is ascites and edema ba are symptoms of heart failure?
Okay, so yung ascites, yung lumalaki yung tiyan or yung accumulation of fluids through your to the abdomen, okay, or yung tiyan ninyo, is a sign, probably can be also a sign of heart failure. Ibig sabihin right-sided heart failure. Pag nag-fail yung left, magkakos na rin siya ng right side. Bumabalik to the lungs, and then to the liver, and then to your abdomen, yung fluid, and then to your lower extremity. So it can be a sign also of heart failure, ascites. So, but ascites can also be a sign of liver problems. So you have to go to your doctor para ma-recognize nila. So marami pwedeng maging cause ascites. Okay.
Okay. Thank you, sir. As Dr. Jimenez said, these are non-specific symptoms, but it's a possibility also that you have heart failure if you have those kind of symptoms. Nako, ang dami pa nating mga tanong, Dr. Jimenez. Mukhang mabenta ka ngayon, sir. Ito po, practical question. Alam ko maraming gustong malaman yung sagot na to. How do you know if the shortness of breath or difficulty of breathing is caused by bronchial asthma, sir, or heart disease?
Okay. So difficult yan pag ganito lang yung tanong natin. No? So, you really cannot differentiate it pagka question and answer lang tayo. You need to go to your doctor so that they will be able to examine you and ask questions if you really have the propensity for having heart problem. Kaya ganun yung shortness of breath ninyo. So, or kung asthma siya. Like marami yon. Like yung may risk factors ka, diabetic ka ba, hypertensive ka ba, may problem ba, nagkaroon ba ng heart attack yung family mo, mataas ba yung cholesterol mo. Kung ganun yung features mo, baka most likely you're having a problem with heart failure. Kung bata ka naman na parang less likely for you to have a heart disease, baka asthma siya. So, and then there are a lot of tests to make sure that or differentiate asthma and heart failure. So you really need to go to your doctor para ma-differentiate siya.
Okay. Tsaka dapat hindi sila nagse-self-medicate, no, sir, no?
Correct.
Para at least lalong makasama if ever
And,
man.
yes, remember, don't take anti-asthmatic drugs ng ganun lang, no? Galing sa inyong kapitbahay or bigay ng inyong nanay, no, or yung kapatid, no? Kala nyo asthma, tapos binigay niya, tapos heart failure pala kayo, it will worsen your heart failure.
Okay, thank you so much, Dr. Rodney. So ito naman po, regarding naman sa exercise, as you know, no, nowadays, a lot of people actually go out for biking, running, no? So ang question po ng ating viewer, normal po ba, Doc, kapag nag-exercise, you would have a heart rate of 180 to 190, especially pag umaakyat daw po sila, no? Then, ano po ba yung dapat i-watch out pag nagkakaroon po ng ganong heart rate, sir, during exercise?
There's a crude way of doing this, and we've been doing this for a long time already. I don't know if this has already changed. I don't know with Rod, mas bata siya sa akin. But it doesn't look like na mas bata. Hindi, joke lang.
Magka-batch nga daw kami po.
So, 220 minus your age and then multiply it to 85%. That should be the heart rate na ma-achieve mo. Beyond that, it can probably cause some problems, no? Kasi yun yung magka-cause siya ng ischemia, no? Kasi parang hindi na kaya ng body mo to produce or to flow the normal blood to the heart, no, pagka sobrang bilis. So just compute in crude way, 220 minus your age and then times 85%. Dapat yun yung heart rate na ma-achieve natin.
Okay. Thank you, sir. Ganun pa rin naman, sir. No? Since magka-batch tayo, ganun pa rin naman yung pag-compute ng... kasi beyond, actually, we're computing for 100%. 220 minus yung age niya, that's 100%. So we allow 85%, as you said, sir. So i-multiply lang po yan. Kasi beyond that, doon tayo nagkakaroon po ng mga symptoms na para kasi hindi na natotolerate ni heart. Okay. Ito, medyo personal, sir, yung kanyang tanong. Sabi niya, no, parang he was experiencing chest pain and he went to his doctor and CT coronaries would reveal a normal results, except that no, yung abnormal lang po sa kanyang laboratory daw po, sir, yung LDL and HDL na lang, sir, na borderline. Hence he was diagnosed with dyslipidemia. I was told what I felt was just simple muscle pain or stress, maybe after an exercise from yesterday. Sabi niya, ang tanong niya, sir, okay lang daw po ba yon yung kanyang chest pain ba na pwede ba daw muscle pain lang daw yan? He's taking anti-hypertensive medication.
Okay.
Normal yung workup niya.
Except having bored. That, nawala yung question.
Nawala yung question.
Check ko
ba? Tinanggal na.
Teka, tingnan natin dito. Ano ko yung ano eh.
Yung buong kanya. Sabi niya,
borderline daw siya eh. Pero dyslipidemic. Okay.
Yes.
Tapos, diba? You have an intermediate risk of so nasa gitna ka na pwede magkaroon ka ng problem with heart, no? Heart attack, kanyan, intermediate siya. You're not in the high risk, wala ka sa low. Na may chance ka pa rin magkaroon ng heart problem. But si Anjo was already done. I suppose this is what she is telling, he or she is telling me. He pala. Na CT coronary angio. Kung yan yung nagawa and they turn out to be normal, then most likely it's normal. Now, CT coronary has a high or an accuracy rate pagka normal or normal yung high negative predictive value. Ibig sabihin nun, pag normal siya, normal talaga siya. No? Hindi siya, wala nang iba.
Wala
Okay?
siyang
Chance
So pwede muscle pain yun, sir, na? Pwede
most
muscle pain.
likely muscle pain siya.
Okay. So ito, this is a very practical question, especially to those this is a very practical question, especially to those viewers na nagda-diet. Sir, the question is, what is the healthiest snack to keep your heart healthy? Nuts was provided earlier as example now, but if someone has high risk or high uric acid, what is the best alternate then, sir, sa mga snacks?
Wrong notion yung nuts na high in uric acid. Yung high talaga in uric acid are the red meat, no? So yung mga lamang loob, yan yung mga high in uric acid. Nuts actually hindi siya so nuts is actually one of the best snacks that you can have. And then berries, no? Or yung mga fruits, and then carrots and yung mga celery.
Patatas. So pwedeng french fries from Jollibee or from...
Hindi pwede.
Okay.
Mataas yun sa trans fat. No? So,
fatty.
Mataas siya. Yung mga oat cookies, no? Yung mga high in grains, yun yung magandang snacks.
Okay. Sir, ito, how will you differentiate panic attack from heart attack?
Okay. Kailangan maging doktor ka talaga, no? Kasi parang hirap. Okay. Kasi kayo mga doctors, we are basing our diagnosis or assessment through evidence, no? So mga pretest probability. So hindi kami basta-basta nagsasabi, wala kang heart attack, wala. Yung mga pretest probability tulad ng ano bang klaseng angina yan, yung chest pain. Yan ba mabigat? Kung kinukurot lang, ito yung tusok-tusok lang, most likely it's not, no? coming from the heart, no? Is it effort related? Yun, no? So most likely coming from the heart. Are you male? No, kung lalaki ka, mataas yung chances mo Are you 40 years and above? Tataas na rin yun, no? Pagka sa 40 years and above. Maraming chances daw. So kung ikaw ay female, tapos wala pang family, sabi ko family history pa pala, no? Family history, wala kang ibang risk factors, diabetes or hypertension, you are not smoker, and then ganun yung mo, and then triggered pala siya with the breakup with your boyfriend or your girlfriend, then most likely it's a panic attack, no? Pero hindi rin, no? Ang panic attacks is problem with psych din siya, no? So it's a valid symptoms na dapat i-address ng doctor, no? Hindi dapat siya pinagtatawanan, no? Kasi it mimics really heart problem. Lagi silang pupunta sa ER, no? So to differentiate that, aside from the pretest probability or history, magte-test yung doctor, stress testing and blood test, no? To rule out other problems.
Okay, thank you, sir. And in relation to that, may isang question din po na parang related po dyan. Sabi niya, I'm taking hypertensive medications, but it's still normal, but sometimes it shoots up, sir, kapag nagiging emotional siya. Normal po ba daw yun, sir?
Yes, yun yung ito po yung iwasan ninyo. Every day, meron po tayong spikes of increase in blood pressure, even if we're not a hypertensive patient, and even if we are taking blood pressure anti-hypertensive medication or blood pressure medications. So dapat pagka emotionally hype kayo, and then it will increase your blood pressure. Do not take anything that will rapidly decrease your blood pressure, like clonidine or catapres, no? It will rapidly decrease your blood pressure and then will cause hypoperfusion o walang blood flow sa brain ninyo, and the likelihood that it will cause stroke is higher. So dapat alam natin that if we are in pain, if we are uncomfortable, if we are galit, it will increase your blood pressure. Relax lang. Okay.
At normal lang yan, na mag-shoot up minsan, diba? Sir, thank you again. And isa pa, sir, you mentioned earlier, diba, in Life Simple 7 about involving yourself in exercise. So, sir, is doing household chores equivalent to an exercise po? na sinasabi
Yes,
niya.
it is. No? So, meron tayong tinatawag na metabolic equivalence. No?
Equivalence.
So
Yeah.
nasa pagka nagagawa mo siya, yung household chores, hindi yan madali, no? Yung household chores yung pagwawalis, yung paglalaba, even washing machine siya, no? If nagagawa mo siya, yung functional class mo is also okay, no? So maganda siya. So it's also considered as an exercise. Pero better if dagdagan mo ng walking, 10,000 steps.
Okay. Sige. Sir, this is quite technical in terms of the lab test for heart failure. Ang question po dyan, sir, what is pro-BNP and is it expensive?
Yeah. But NT-proBNP, no, is a measure of the hormones na ba? Hindi siya hormones. It is a chemical substance that is being released na pag nagse-stretch yung one of the chambers of the heart, no? Ibig sabihin na pag nag-stretch yon, ibig sabihin may heart failure, no? So yun yung na-release. Pag mataas yon, ibig sabihin probably you are experiencing heart failure, most likely, no? Pero meron din kasing mga conditions na nag-increase yung pro-BNP. It is expensive, no? So but it is good in monitoring if you really have a heart failure compared to pulmo, no? Or lung problems, no? Para differentiate niya. Number 2, useful siya para to know if the medications that we are giving you is effective or are effective. Okay.
Do you have a ballpark figure po, sir, about the price?
Sa St. Luke's, 10,000 pesos, di ba?
Yeah, mga 8 to 10,000.
Minus 20% sa ibang mga hospitals, mga 8,000 yan, 5 to 8,000.
Okay, thank you, sir. Sir, is 120/80 blood pressure applicable to all ages?
No, kasi sa pagpedia may mababa eh. So I don't know it. I'm not familiar much of the pediatric level of the BP. Pero pag adult ka, dapat 120/80 dapat ang BP mo. Pag hypertensive ka na, na-diagnose ka na, and you're under medications, yung blood pressure mo pwede nang less than 140 lang. No? Kung, unless you are diabetic or may problem ka with kidneys, dapat 120/80. No? So, dapat ganon. So, pagka hypertensive ka. No? So, pero pagka hindi ka pa hypertensive or gusto mo malaman kung normal, 120/80 talaga. No?
Okay, thank you, sir. In the interest of time, I guess we can accommodate one more question. Meron pa po ba kayong tanong?
Tingnan mo nga.
Sige, kung wala.
Due to pandemic, I've been taking many over-the-counter vitamins.
Sir, siguro ako, I have questions lang po related to COVID. No? So, di ba, we're still on GCQ, right? So, sometimes we were afraid actually to go out kasi nga, how would you recommend po, as a form of exercise among elderly patients na nasa bahay lang?
Ulit. Pag COVID.
Yeah, now that COVID po and a lot of people cannot really go out or they're afraid of going out po, no? And you're suggesting that they need really to exercise as well. So what are the practical po aside from moving around the house? Ano pa po kaya ang pwede nating i-advise sa kanila as a practical form or way of exercise sa ating mga senior citizens, sir?
Okay. Pwede, ang hirap magturo kasi maliit lang yung So,
okay, especially di ka makagalaw.
Okay, pwede yung side jacks, no? Yung paa mo.
Jumping jack.
Hindi ka magja-jump.
Hindi ka magja-jump, okay.
Hindi ka magja-jump. Yung side lang, no? Yung sa side lang, mo yung paa mo sa gilid lang, tapos sa gilid. Hindi mo kailangan mag-jump, no? Yun, one yun. Squat. Yung squat, pero may upuan. Okay. So tatayo ka sa upuan, upo ka ulit. Tatayo sa upuan, upo ka ulit. Madali lang yun. Okay. Kung push-up naman, mag-push-up ka sa wall instead of sa sahig. Okay.
Yeah.
So ba? Lunges, medyo mahirap yun, lalo na pag sa may arthritis na. So,
yeah.
yung
tapos sir,
upuan para hindi kayo malaglag.
Okay. Baka magkabali-bali din naman yung mga buto nila. No? Isa pang practical question, sir, among elder, kasi they're really afraid nga of going out and to see their doctors. Do you advise, sir, to have teleconsultation or telemedicine sa mga doctors sila po? Kasi nga, takot pa sila pumunta sa hospital eh. Do you
Yeah.
recommend that po, Dr. Jimenez?
Yeah, teleconsult is good also kasi makikita naman ng doctors kung nahihirapan kang huminga, kung ano, no, and then depending on what history you are giving to the doctors, so malalaman nila if you are in need of emergency care. No? So, pero pinakamaganda before you, mas maganda kung teleconsult kayo, you have your BP apparatus with you. No? Bili na kayo ng portable BP apparatus na magagamit ninyo so that the doctors can see, no, kung ano yung blood pressure nyo on that and heart rate, no, and then they will teach you also. Maganda, practical naman siya. Okay naman din siya.
Okay. I guess it's already 1:10, no? 1:10, 1:15 p.m., 1:13 p.m. to be exact. So, to our viewers, hopefully you pick up something, no, to this webinar. Practical.
Dami nilang questions, no?
Oo, dami pang mga tanong, and I know marami pa tayo. We have one Maxicare doctor as advertised earlier, no? Meron tayong 24/7 doctors in Maxicare. If you really need to see your doctors po and you're afraid of going to the hospital, you can maximize po yung ating pong mga doctors through teleconsultation. And thank you also for Maxicare for having this platform to educate people, no, their clients, to have this kind of discussion, no, about protecting your heart, no, not just during February, but of course every month, no, we need to protect our heart. Okay?
Meron pala, Rod, ano lang,
Yes, sir.
meron akong isang gustong interesting to ask.
Question, sir. Okay, sir. Ano yun,
about
sir?
intermittent fasting, no? Intermittent fasting. Okay.
Yeah.
Yung statement ng Philippine Heart Association tsaka Philippine Lipid Society, no? And hypertension, and then the endocrinologists, marami yan. Nagawa sila ng statement, and nagawa kami ng statement with regard to intermittent fasting. If you do not have comorbid illness like diabetes, hypertension, if you are a normal person and you're just overweight or obese, it's good, okay siya, no, for a year that you do the intermittent fasting. And then you choose a lifestyle that, or better kasi na diet talaga is calorie counting. Okay? Intermittent fasting is maganda pagka wala kang problem sa heart, no? Sa heart, wala, no? Yung obesity lang yung problema mo. Okay siya. Pati yung ketogenic diet, no? Pagka hindi na mataas yung cholesterol, baba ka, okay siya pag wala kang problema, no? Pero hanggang 1 year lang siya. Pero pag meron kang problema, mas lalong bibigay na. That's it, no? So,
yeah, thank you so much, sir, for clarifying that, no? Kasi nga hot issues yan, eh. Hot issues yung ketogenic diet, ngayon mga vegan diet, no? Ito yung mga pinag-uusapan natin ngayon sa ating mga societies. So, hopefully you learned something today. Guys, Ma'am Patricia, do you have any question po, being our host?
Shout out sa aking batchmate no high school. I think she asked questions. Si Claire. Hi, Claire.
Hi, Claire.
Yes.
Yes, Patricia?
Yes, actually, Dr. Rodney and Dr. Rod, ang dami talagang magagandang questions, but we really appreciate all the insights, particularly that last one also. That's very interesting. Thanks for sharing that bit of information to all of us. I mean, that gives a lot of clarity, especially now na around lunchtime pa rin, yung mga Maxicare members natin who are still watching and who are still here with us. But that really ends our Q&A for today. Dr. Castro and Dr. Jimenez, your final words to our viewers here at our Maxicare Wellness Fridays.
Okay, Rod, ikaw muna.
Yeah. Sa akin, practical lang po, no? Parang for us, especially in this time of COVID, as mentioned by Dr. Jimenez, always protect your heart. Do not assume, no, that you're healthy. Maximize this time actually to engage yourself. No, first of all, spend time with your family. And do not forget the practical aspects po of protecting yourself against this COVID-19, hand washing, social distancing. No? So these are very important aspects. Wearing your your face mask and your face shield. So, Dr. Menes?
Okay, so sa Philippine Heart Association, we have this advocacy, yung 50 to 100, no? 5 to 100, 5 servings of vegetables and fruits, okay? Every day, unless you're diabetic, you have to take note of that. No? And then 2 grams of salt a day lang, wala masyado ano. And sa mga bata, dapat 2 hours of screen time lang. Pero mahirap ngayon COVID, no? So medyo mahirap sa atin yung 2 hours. One is 1 hour exercise. So every hour you should do 1 minute exercise, okay? And then zero smoking, and then zero sugary beverage. Water lang, no? 5 to 100, no? So 5 to 100. Okay? And the life simples 7. Okay. Pareho lang siya actually. No? So yung 50, 100 saka life simple 7. Okay.
Wow, very practical and easy for us to, of course, follow and remember. Thank you so much, Dr. Rodney Jimenez. I really appreciate this wonderful session. And to our attendees, thank you so much for participating in the Q&A and for being so engaged throughout the event. Of course, special thanks to Dr. Castro as well, who wonderfully took us through all those questions that you all were asking. To our Maxicare members, can we invite you now to please take a few moments to answer a feedback form after this event? Now, there's a link on the chat that's being shared, and you see on your screens there's a QR code also, and you can actually capture this QR code now so that you can share your feedback, because it would be most appreciated. Thank you in advance for doing that. Now, this is another moment that I'm sure you all are waiting for. We asked you to stay, right? Because we do have a raffle draw. Well, we are ready to announce the winners of our raffle. The winners were randomly selected by our staff, and again, we will have one winner who will receive a portable yoga mat, a winner who will receive a J umbrella, and a winner who will get a mini clutch. Now, the Maxicare team will get in touch with you about claiming your prizes, so don't worry about a thing. But here it is. We have the list of our winners. Shall we see our winners? Francis May Talamayan of Standard Insurance Corporation, who will win our portable yoga mat. Thanks so much for being here and for listening. Julius de Guzman from EITI, who gets the J umbrella. Perfect, because it's really sunny right now. Brandon Perez, Maxicare Healthcare Corporation, wins the mini clutch. Of course, this is open for everyone, but we appreciate all of you for being here this afternoon. Wow, congratulations. And like I said, our Maxicare team will get in touch with you guys in terms of claiming your prizes. Now, here are 2 real quick poll questions before you go. Just click on the answer that best suits you. And this is our first question. Something we ask you all the time. Do you want to live your best life? It's a yes or an oo. I haven't met anyone yet who does not want to do just that. And you guys are here with Maxicare because they take care of you. They ensure that you will live your best life. And it's also a resounding yes, of course, for all of you. Thanks so much. Now, what topics would you guys like to see in the next Wellness Fridays? You can select multiple answers. So, homeschooling ba? Parenting habits ba ang gusto niyong malaman? What about mental health in the workplace? I'm sure that's going to be very exciting, just like strengthening immunity against any diseases and taking care of the skin. Lalo na kasi summer na, di ba? So this is the time when we get a lot of these reminders to take care of the skin. But mental health in the workplace is something that is very significant for a lot of you, and of course the other topics as well. And we listen to you guys all the time. If you enjoy this experience, please do share it on your social media using the hashtag Live Your Best Life and the hashtag Maxicare Wellness Fridays. And you can tag Maxicare on Facebook at Maxicare Healthcare Corp and on Instagram at Maxicare Healthcare. Don't forget to also follow and visit on Instagram the health and wellness of Maxicare, which is at Maxicare Health and Wellness. Tag them also when sharing about your wonderful takeaways today from this wonderful event. And don't forget, please subscribe also to the YouTube channel of Maxicare, and that is Maxicare Healthcare Corporation. Now, to learn more about Maxicare's products, and I've told many people to go to this, www.shop.maxicare.com.ph. All the products are there. It's so easy to understand what they have to offer you. And you can also send them a message through their FB Messenger. Very helpful. If you guys guys have questions about Maxicare's Wellness Fridays, you may send an email to maxicare@maxicare.com.ph. See you guys at the next Maxicare Wellness Fridays, which will be on Feb 26. Magkakasama na naman tayo where we learn more about valuing mental health in the workplace. See, I told you guys that we listen to all of you almost instant. But this will be led by Dr. Edgar Tolentino. Wonderful, wonderful speaker. That event will happen at 5 p.m. Okay, so mark your calendars, 5 p.m. on the 26th. So make sure that even the time, you guys will mark it on your calendar. The QR code for the registration is being flashed on your screen. So save that QR code. Might as well go to it also later today. And also, as an advance invitation, mark your calendars for March 5 because that is where we will be talking about moving forward with resilience. And that is gonna be with Dr. Gia Season. I also would like to hear that moving forward with resilience. Dr. Gia Season will be our speaker there, and I'm sure a lot of you will be curious and will be seeing us there. That ends our event for this afternoon. Thank you so much for being with us this Friday morning. We hope that you enjoyed, and of course, you were able to take away all this meaningful information that was shared with all of you by our wonderful speaker, Dr. Rodney Jimenez, and our moderator, Dr. Rod Castro. Thanks again, everyone. I'm Patricia Bermudez-Izan. Have a great day. And we know that with Maxicare, you can live your best life.